When talking about public health and how to create a better and healthier environment for the future, it really all starts with children. Traditional schools have implemented many ways to keep kids active, whether it be recess, physical education classes, or extracurriculars like sports that the kids can sign up for. It is important to get homeschooled children active when they don't have traditional recess and physical education classes where they can be active in large group settings. Children are very susceptible to new ideas, and by planting seeds of why physical health is important in their little minds, they are more likely to receive these ideas well. Another thing is that if physical activity is fun, most children will gladly participate. By teaching the children the importance of physical activity at an early age, it can have a lasting impact on their overall health by reducing their risks as adults for cardiovascular disease and obesity.
It is very important that every person is physically fit and gets the minimum daily activity in so that they can stay healthy. A lack of physical activity can lead to many health issues. These plans should help lower the total number of individuals suffering from cardiovascular health issues. We first have to educate them on health benefits and being physically active and how just 1 hour a day decreases health risks drastically. We will encourage that each student gets a minimum of 1 hour of moderate to vigorous aerobic activity each day. Every time they come into the clinic, they will be asked about their physical activity in order to keep reminding them. On top of this, we will suggest that they continue to implement these habits into their daily activity throughout their whole life. We will also create a community organization for homeschool families to come together and participate in physical education classes.
We chose two health promotion theories that guided our plan, the first being theory of planned behavior. As chiropractors, we are oftentimes in contact with our patients more frequently than any other health provider and therefore could have a direct effect on how they perceive physical activity. Considering the four concepts of the theory of planned behavior, we can see how to promote increased physical activity. By organizing community health events for homeschool families, we can increase behavioral intention and increase the likelihood of children being more active through group activities. These events will also change their attitude in a positive way towards physical activity. As long as we, as chiropractors, create a healthy relationship with our patients and promote the benefits of increased physical activity, we can influence their beliefs that key individuals in their lives approve of that activity. If all three of the first concepts can be achieved, children will begin to understand and believe that they have control over their physical activity and continue to be more active throughout their lives. The second theory that we chose was the community organization theory. By introducing and promoting physical activity in homeschooled children via community events, we can help empower the homeschooled family's community to create change from within. These activities will also create trust between families, furthering and promoting more positive growth. Community events centered around physical activity for children not only helps to improve their physical health, but allows them to learn, have a sense of belonging, and create lasting relationships among their peers. We believe that once started, participants will see the benefits of community-led events and begin to understand that they have the ability to take an active role in shaping their communities and their future well-being.
Homeschool programs don't always have a requirement for physical activity, and physical education, nutrition, or exercise information is largely left up to parents. To implement these strategies that we've been discussing to increase physical activity in the homeschool community, it's important as chiropractors to measure physical activity as a vital sign when we see these children in for their appointments. During their visits, we can document the number of minutes per week they are participating in physical activity, and this question would let the patient and their parents know that exercise is an important part of health, just like other vital signs we test for. This also opens the conversation between us as providers and parents to discuss the importance of physical activity in their children's daily life. We can also work with parents to create environments that are easier to achieve physical activity. This can include finding places in the community that are safe to walk, bike, and play, or creating a program for them that combines education and exercise. We can also promote campaigns in the community that are open to in-school and homeschooled families to create a sense of community between those two areas. These campaigns can also help identify some interventions to better promote health and wellness within their learning environment as well as outside of the classroom. Another important resource to involve in our implementation process would be an outlet to locate services that help homeschooled families find ways to be more active where they learn, live, and play. It would be beneficial to create some kind of online program where practitioners and members of many different communities can evaluate and learn from other programs to identify and spread the best practices to homeschooled children and their families.
When it comes to the anticipated challenges, there's really just going to be kind of two main hurdles we have to get over, I guess, if you will. Starting off with the diet. Now, kids and a healthy diet sometimes just don't go together. As a kid, you want sugar, you want sweets, you want, fatty foods that taste good. You're not going to choose a piece of broccoli over a popsicle. It's just not in a kid's nature. So finding foods that not only taste good, but are also healthy for you is a problem. And then when you couple that with the fact that oftentimes healthy whole foods are just far more expensive for some reason than processed unhealthy foods, I guess, if you will, we're going to run into this hurdle. And so we need to find a way over that. Secondly, we need to create events that kids want to go to. The problem is going to be electronics are so ingrained in kids' lives nowadays that sometimes peeling them away from those is just hard. And when a kid really, really wants to just sit on the couch and play video games or watch TV or sit on their phone all day, that's going to lead to some major consequences down the road. So what we need to try to do is to help them to realize that playing outside is fun and it is enjoyable. And once they do, then they can break those habits. But those are kind of going to be our two main hurdles that we got to get over.
In the evaluation process, we encourage our patients to follow their daily physical activity goals of at least 1 hour a day with some sort of moderate to vigorous activity alongside consuming a healthy diet. We also recommend our patients to join an organized sport team or partake in community-based health campaigns. Studies have shown that individuals are more likely to decrease their risk of cardiovascular diseases when they are physically active on a consistent basis. And by adapting these measures at each chiropractic check-in, we will evaluate their vitals such as blood pressure, pulse, weight to see the positive trend of maintaining or lowering each category. And lastly, through our intervention, not only will our patients have better health, but we'll have also expanded their knowledge and friendships through community-based interaction.
In conclusion, we as health and wellness professionals need to do a better job in reaching out to the homeschool community. Homeschool children's fitness deficits could affect their health short-term and in their future as well. The solution is to provide better advice for those students and their parents by being an active resource in the community. It is important to communicate with other healthcare professionals and include them in this process, which will help create a better space for these parents to know that the benefits of physical activity and how to go about implementing these programs in their children's everyday lives.